obesity I think are apparent, but I'll try to highlight some of them. We all recognize the significant toll that tobacco takes on our society in terms of health and economics. And just as with obesity, it takes multiple strategies to reduce tobacco use. I'll be talking about one strategy, using mass media, but many other techniques have been shown to be very helpful. Smoke-free air laws, limiting opportunities for people to smoke in public places, increasing the price of tobacco through excise taxes, but also providing support for cessation for those who want to quit. Because if you have a media campaign, it's more than just about raising awareness. It's about affecting behavior change. But if you want people to change behavior, you have to give them opportunities. So in the case of smoking, you have to give them opportunities for cessation programs. The analogous thing that we talked about with obesity, if you're going to have an awareness campaign, a campaign to try to eventually change behavior, you have to have the support in the community for exercise and other opportunities for healthy eating. For example, you need to have plentiful fruits and vegetables. Oops. So I do want to recognize there is a lot of exciting things going on in tobacco control in the Gulf countries. And I do hope that I will get to learn more and discuss all of these issues with many of you and learn from you. What I hope is that I can talk about mass media campaigns in a way that will be helpful to you all. Let's see. Because one of the things that my colleague Tim Gable mentioned is that it's important to celebrate the successes. And I think that in tobacco control, that's one thing I think those of you who are working against, fighting against obesity and diabetes can look forward to is the success that we've had in tobacco control around the world by implementing mass media campaigns and other policies. And there's a strong evidence base now for tobacco control that shows that mass media campaigns can be effective in reducing tobacco use. And there's no reason why those same lessons can't be applied to promoting physical activity and increasing healthy eating. But at the same time, I called this presentation the science behind developing effective mass media campaigns. Because although, and my other colleague, Dr. Tom Herger, mentioned, with the obesity and diabetes problem, it does feel gratifying to build new hospitals and to have lots of procedures that have an immediate effect on the health of people. But I think when we combat a public health problem as big as obesity, as big as tobacco, it's really about affecting the